have the meeting is being recorded. And I'm going to do a few housekeeping items. The meeting is being recorded. All of the participants are muted. During the presentation, please use the chat function to ask questions. At the end of the seminar, I will pose questions from the chat and others that come up to Hernan for his, and he'll be able to respond then. And then for those of you interested, Spanish interpretation is available for this presentation. In order to use it, please select Spanish from the interpretation language selection below. It's the icon that looks a little bit like a globe. And then you'll be able to hear the translation. I am so happy to introduce Hernan Hernandez. He's the Executive Director of the California Farmworker Foundation. And he's going to be talking today about his community organization's response to COVID-19, but also more broadly about how the organization partners with industry and workers to protect workers and farm workers. I'm thrilled to have you, Hernan, and we look forward to hearing about the program. Thank you so much.
Yes, thank you, Heather, for having me here today. Look forward to discussing the presentation and answering any questions. So the California Farmworker Foundation, we're based out of Delano, California. We're relatively a young organization. We're only about 4 years old. Our whole model from the get-go when we started the California Farmworker Foundation was how do we give back to farm workers? How do we look at different programs and services that are going to improve the quality of life? And also, how do we empower farm workers so that they can have a say over their community challenges or issues that they have and face on a day-to-day basis? So we've been working in Delano, California, now in the Central Valley, in the Coachella Valley, San Luis Obispo, and a little bit in the Napa Valley with the intention of improving farm worker lives. And we do this by engaging in a variety of personal and professional development programs that we have done for the past 4 years. So once again, we're based out of Delano, California, and our footprint continues to grow throughout California. So if you could please move the slide. So we're a 501c3 nonprofit, community-based organizations that serves and support farm workers by providing programs and services to improve their quality of life. We take this to heart and we continue to work on a day-to-day basis on creating new programs, developing new partnerships, so that therefore farm workers have the programs, have the services available to them at their work sites and at their communities. Next slide, please. So when we started the California Farmworker Foundation, our intention was we always wanted to make farm workers a part of any of our programming and any of our services that we offer to them. So till this day, our work plan revolves around asking farm workers every year exactly what are their major needs in their communities, in their work sites. And then what we do is we capture that data through focus groups, through data collection of surveys, and we analyze the data, and then we create programming based on that information. When we started, we did the same thing. We went to crews throughout the Central Valley, to communities, rural communities throughout the Central Valley, and we were asking farm workers exactly what do they want us to engage in, where do they want us to invest the time and effort that we were going to be producing every year. And from this, we got our objectives. We got professional development. We know that a lot of farm workers wanted job trainings. They wanted to have access to these trainings, not only at a vocational level, but also creating that opportunity for them to go out and engage in another field. And personal development, we also had a lot of farm workers that were interested in just bettering themselves personally, whether it was through women's self-defense classes or through some financial literacy classes. So we understood that farm workers wanted to better themselves personally, and we decided to put that as one of our objectives. Health and wellness, we noticed that we were dealing with a population that needed access to healthcare, that needed access to providers. So how can we facilitate that as a foundation, and how do we create programming not only in their communities in which they can engage in healthy behaviors, but how does that programming also translate into the work sites so that therefore we can make sure that farm workers have access to that much needed healthcare. Community engagement, a lot of farm workers when we talked to, they felt like disenfranchised. They felt like they needed to have a voice in their communities. A lot of them would complain about the different challenges and issues facing their communities, such as the poor quality of water, the infrastructure, and just in general, not being at par to what they felt they deserved. And so we work a lot in community advocacy and developing our farm worker committees so that therefore they can go and advocate for policies that will benefit their communities. Immigration and citizenship, when we started in 2016, this was like at the heart of what the needs were back then. The data was telling us that a lot of farm workers needed help with knowing their rights, access to these immigration services, because they felt threatened, they felt scared. And so we still to this day carry on with offering immigration and citizenship services at our office location, but also at some of the rural communities in which we have a presence. So our whole goals as the foundation, we want to build healthy and sustainable communities. We want to make sure that we develop a network of leaders and decision makers. And we want to provide opportunities for personal and professional growth for farm workers. We partner with public, private, and government sectors for the betterment of farm workers. And we want to make sure that farm workers through the foundation have a voice, they have an outlet through our farm worker education committees, so that therefore they can go out and advocate for themselves and their families. One of the interesting things when we started the foundation, our model was based on how do we collaborate with every entity that works in agriculture so farm workers can have access to these types of programs, to these types of services, and how do we make sure that agriculture companies are engaged and that they continue to invest their time in the betterment of their workforce. So one of the things in which we did is we started an ambassador program. And what we did is the ambassador program is a decision maker within each company. It's typically a head of human resources, heads of operations. And what their sole purpose is to do is for not only becoming a champion of the California Farmworker Foundation, but also to promote the programs, the projects, activities, and also the services that we send directly to the farm worker at their work sites. So one example, when we ship thousands of pounds of food every week to farm working crews to tackle food insecurity, our ambassador plays a crucial role in making sure that we have access, that we coordinate with them so that farm workers have access to these type of services. As of right now, we've done anything from direct health services in the fields to immigration and citizenship services in the fields to COVID-19 testing, COVID-19 vaccination, COVID-19 health education. So we've done a little bit of everything in the work sites during farm workers during the time in which farm workers are compensated for them to hear about the programming and to participate in the programming, because we know that we want to make sure that whenever we recruit a company, we have an ambassador, that it really is for the benefit of farm workers. And we want to make sure that they not only invest their time, but that they also invest their resources so that farm workers will feel comfortable receiving these services and programs at their work sites or at their community. So our ambassador model continues to grow. Right now, we have tens of ambassadors throughout the Central Valley, in the Coachella Valley, in San Luis Obispo, and in Napa. And the intention for us is to grow this ambassador program, because we know that if we're able to grow the ambassador program to different companies throughout the state of California, then farm workers would have direct access to the programs and services that the California Farmworker Foundation offers to them and their families. The ambassadors, they do go through biannual trainings in which we share data, we share needs about the farm workers, and we also talk about some of the new programs and services that we're going to deliver in the services. Sorry about that. That we're going to deliver in the fields with their help on a day-to-day basis. So one thing we're very, proud of is that whenever somebody joins our program, it's not just about cutting a check to the organization, but rather putting in the time and putting in the effort. So it's a commitment that we take to heart, and that we also hold our growers accountable, so that therefore we know for a fact that they are trying to champion the foundation's programs and services, and that we are actually truly with the right intentions, making sure that farm workers have access to these services. So this is Luis Katsurayama. He's our ambassador at Jasmine Vineyards. And we've done a lot of great work throughout California with this ambassador program model in each company. Next slide, please. So here's when we come to data. We're big on data. We always want to know exactly what farm workers would be interested in, whether it's conducting focus group or whether it's having them fill out a survey, in which we call the membership application. So the way we look at this is this survey allows us to know exactly what the farm worker needs are. So whether they're interested in ESL classes and citizenship classes, job training, nutrition workshops, or whether they need help with document translation, opening up unemployment, or college applications for their kids or scholarships. So this gives us information in which we then utilize to create work plans in farm working communities and farm working work sites. All this is voluntary. Nobody gets pressure to sign on to the CFF membership application. The intention is not only to know exactly what the needs of farm workers are, but we also want to empower farm workers, and we want them to have a say. We want them to build their own farm worker committee so that therefore they can advocate for policies that are beneficial to their communities. And one way in which we decided to do this was by a membership application. So one of the things that I always tell farm workers when I go out and talk to them is we want to make sure that we address some of the key issues that are affecting their quality of life. And one of the ways in which we do this is by literally talking to them about operating in a collective. How does it translate into a group of 10, 20, 30, 40 farm workers being represented in one community, as opposed to just having one or two representatives represented from that community? So we tell them that it goes a long way if they have numbers. And the only way we're going to create systematic change is if there's numbers and if there's the willingness of farm workers to get involved and to engage in some of the political process in which they work in. Given that we are a 501c3 organization, we don't tackle on any issues that are partisan. We stay away from that. We just focus on issues that directly affect farm workers and their quality of life. And we work on making sure that farm workers have a say at the table, so that therefore policies come from the state or the local level that benefit them and their families. Right now, we are at over 5,000 members of the California Farmworker Foundation from the Central Valley, the coast, and the Coachella Valley. So when you look at needs assessment, we like to look at every community, we like to look at every city in which we operate, and then we like to look at data and look at information that then translates into us creating our work plan. So this is just a quick breakdown on some of the communities in which we're in, how many members are in each community, and what they're telling us that their major needs are. So this data that we share the numbers, we share the information also with local community colleges, school districts, and also certain CBOs and also government sectors, so that they can know exactly what are some of the most pressing needs of farm workers, and then how do we work together in order to create the programming to fulfill those needs. So this information is shared by numbers only. We never provide any private contact information to anyone. That information just stays within ourselves. But when it comes to aggregate data, we do provide that information for the betterment of farm workers with organizations that we know are going to utilize it and then carry on in helping us create the programming and services that farm workers need in those communities. So next slide, please. These are just some of our industry partnerships. We work very closely throughout the Central Valley, throughout the state of California. So when COVID-19 happened, one of the major things that we decided to do is go back to the fields, go back to talking to farm workers. We created focus groups. We started surveying farm workers, and we wanted to know exactly how can we be helpful, how can the California Farmworker Foundation serve as a resource. And through this, we came out with our COVID-19 testing for farm workers, increased food distributions. We created a hotline where farm workers could call us and they can know exactly what are some of the program services available to them. But also if they feel that there were environments in which they needed to know their rights or be contacted with the appropriate department in the state of California, then they can also call us in regards to labor rights, and we'll make sure to refer them out to the appropriate department. Distribution of PPE equipment, farm worker relief fund, virtual health clinics, education and awareness campaign, and also we also did COVID-19 assessments on a monthly basis to still continue to know exactly how farm workers were getting affected and how we could bring direct relief to them. As of now, the only thing that we can add to that is COVID vaccinations. But other than this was information that we collect on a monthly basis and that we create programming around based on farm worker needs. So the COVID-19 farm worker focus groups, when COVID-19 happened, a lot of the farm workers, we started to notice some of the effects that the pandemic was having on them. And a lot of them were telling us that there was significant psychosocial and financial impact on farm workers being surveyed. We also knew that social isolation from friends, family, and faith-based communities were increasing stress levels. Additional sources of stress include anxiety or being infected with COVID-19 and financial stressors. A lot of farm workers were fearful that if they were to get the virus and couldn't go to work, then they were going to lose those wages that was then going to affect their overall ability to pay the bills, including rent and utilities. We noticed that access to medical visits had decreased due to provider offices postponing appointments and a lack of insurance coverage in some cases. As a result, we noticed some farm workers resulting into home remedies to alleviate some of their health concerns. So one of the interesting things when you look at the pandemic and when you look at how we engage and how we utilize our infrastructure to bring direct services to the communities and the work sites of farm workers is you got to understand that when COVID-19 happened, one of the communities that got hit the hardest was the rural communities when it comes to healthcare. And this was at a time when a lot of these communities depended on mobile healthcare units to get their healthcare on a monthly basis. Well, when COVID-19 happened and everybody was expecting this big surge, the first groups that left the front line were the outreach workers, were the healthcare providers. So they all ended up in the urban clinics, hospital systems, getting ready for the surge. And we saw the closure of clinics in rural communities, the closure of mobile healthcare units, and also just the direct non-representation of the outreach workers from CBOs and from healthcare entities and even government sectors. So farm workers were really left to fend for themselves and they had nobody to go to. And one of the things that we noticed was that the CBOs, the healthcare units, they were no longer there. So our job, our task, we stayed in the front lines. We never worked from home, even till this day, never worked from an office at our bedroom, but we actually continue working on the forefront and delivering the services, even at a greater speed once COVID-19 happened, just because we knew that farm workers were in need and that they were asking for some of these services directly in their communities. Next slide, please. So our COVID-19 initiatives, we increased our food distributions, not only at the community sites, we opened up pop-ups that we're still running till this day in new communities. We took on 8 new communities. And then we also started shipping more food directly to the farm worker work sites. So whether it was in San Luis Obispo or the Central Valley, we created a pathway because we know that a lot of the food banks operate at times in which farm workers don't have access to these food banks. So we wanted to make sure that they continue having access to food, and we worked via our ambassador program to make sure that the food was flowing to farm workers directly at the work sites. We also created a COVID-19 Farm Worker Relief Fund to provide farm workers support during the COVID-19 pandemic. The interesting thing about this fund is that 95% of the funds that we're still shipping out today are all going to housing, to rent relief. So California, as you know, has a direct housing crisis, not only in the Bay Area and LA, but it's also seen in rural communities where farm workers live in. And till this day, we're still shipping out most of the funds for farm workers to help them out with rent relief. And this is happening throughout the state of California, not just the Central Valley. We shipped out funds as far as Sonoma County and all the way to Mecca in the Coachella Valley. The other thing we started doing was providing virtual medical consultations for farm workers who suffer from chronic diseases and respiratory illnesses. So when farm workers lost their healthcare providers in the front lines, we started opening up these pop-up tents. And we literally provided medical support in areas like the memorial halls, in areas where the supervisor had an office to lend us, or maybe the library had a place where we can go out there and set up a virtual pop-up clinic. And one of the most important things that I was telling a lot of these FQHCs and healthcare providers was that there was still a digital divide in rural communities. And a lot of times they were pushing a lot this whole virtual clinic model, but it wasn't working. And the farm workers that we work with weren't able to partake in it. And a lot of it had to do with not having access to the Wi-Fi, to the appropriate technology, but also to navigate the systems that some of these FQHCs were utilizing. So the way we were able to solve this problem is by having our staff directly go on site, registering farm workers, providing them with the technology, with the Wi-Fi, and then just making it as easy to the point where the farmer could just sit down and look at the camera and a provider was there to help them out right then and there. Our COVID-19 hotline for farm workers, this was very beneficial. It took a lot of myths away from some of the farm workers that had questions in regards to the health portion of COVID-19. We helped a lot with labor rights. Some farm workers that didn't feel comfortable in some of the work sites, or even that just didn't get the wages that they were supposed to be getting because of whatever situation they were in. So we helped a lot through this COVID-19 hotline. Till this day, this hotline handles the Healthy Harvest program as well in 5 counties. in Madera, Merced, Fresno, Tulare County, and Kings County. So this hotline continues to operate till this day, and it continues to not only provide farm workers with the information that they need in regards to the vaccine or COVID-19, but also continues to help them with the programs and services such as rent relief or any other relief that we see is necessary for the farm worker, so that therefore we can help them out on a day-to-day basis. Next slide, please. We also developed and distributed educational materials of coronavirus at farm worker work sites and communities. We literally shipped out tens of thousands of these flyers throughout California. At one point, the county of Ventura was shipping out 26,000 flyers from the California Farmworker Foundation. And the way in which we did this is we got creative. We started advertising to farm workers at their language. We started developing infographics that they related to and that they were easy to understand. So till this day, we still continue to produce our own internal materials. We continue to survey farm workers on the impacts of COVID-19. And we also distributed PPE gear at the time when even the wildfires were going out of control in California. We were distributing N95s to farm workers at their work sites. Till this day, since the pandemic started, we have distributed over 740,000 PPE materials to farm workers in the state of California. We provided COVID-19 testing for farm workers at their work sites and communities. So we developed the first farm worker route in Kern County that went around to different work sites and tested farm workers. And then we were also part of the state's first pilot program to grant authorization to community-based organizations to do their own testing. So we literally went from testing with a third-party provider about 150 farm workers per day. The second we got granted authorization to test on our own, we tested up to 1,000 farm workers per day throughout the state of California. So we built capacity and our staff was at the forefront testing farm workers. Even till this day, we're testing farm workers at work sites. We've dealt with multiple outbreaks in which we've had a presence and have been able to alleviate with testing. And just to top it off with our COVID-19 initiatives, we're continuing to lead the COVID-19 vaccination of farm workers throughout the state of California. Till this day, just this week alone, we're going to be vaccinating around 4,000 to 5,000 farm workers in 1 week. So we're very proud of that. We want to make sure that the vaccine is accessible to farm workers and their families. And we know that all this has to happen at the work sites. We know that farm workers are not going to go stand for hours in a mega site in an urban location. So we want to make sure that going forward, farm workers have access to the vaccine at their work site during company time, so they're not scared about losing their wages. And also, how do we create some of these sites in the community where we know farm workers in rural communities are in need of these type of programs and services. So next slide, please. So here's one of our virtual pop-up clinic. Somebody told me that our clinic looked like a clinic from Tijuana, but I told them that, we're providing a service. We're out there doing something that nobody has done. And I could tell you this, every farm worker that had access to our clinic got access to quality healthcare. We partnered up with Dr. Payan from Fresno. She's a great doctor, and we were able to deliver the care not only in the language in which farm workers understood, but also with a professional that understood their background and that knew exactly how to best service this population. Our worksite food distributions, this is one of our sites in which we delivered food at the worksite to farm workers so they have access to fresh and healthy food. The U.S. Surgeon General came over to Kern County once and wanted to see our model firsthand. So this was pretty exciting because he wanted to take the model and see how he can translate this into other farm worker communities throughout the United States. We believe working in the present to safeguard our future is important, and we continue to do this on a day-to-day basis. Next slide. So Farmworker Testimonial, Karina, she was one of the farm workers that we seen very early on that lost access to their provider via the mobile health clinic. So she was very thankful that she had the opportunity to see her doctor right then and there. And one thing that everybody should know about farm workers, sometimes we deal with a population that deals with chronic diseases that at a time when a pandemic happened, they couldn't wait 1, 2, 3 months to see a provider or to go into a location and get their medications that they needed. So there was one case I remember in Vitro with Don Silvio, in which his diabetes medication was already running out. We were literally his last line to get the medication, and he was able to get it prescribed through us via the telehealth that we're providing in that community. So I think we're very grateful that we had the opportunity to serve farm workers, not only at their work site, but also at their communities. Next slide. So we believe education is the gateway to a free, healthy, fair, and prosperous society. We take this to heart. We do a lot of education on the ground with some of our partners, Komodo Pharmacy, in this case, looking at the Tagalog and the Ilocano population in Delano. Our farm worker hotline, we want to make sure that farm workers have access to the education materials that they need. And then also when COVID-19 was rampaging our communities, we also developed a campaign called Héroes del Mundo, in which we wanted to recognize farm workers and bring awareness to the sacrifice that they were doing on a day-to-day basis to make sure that everybody still held the fruits and vegetables that they eat on a day-to-day basis, and just wanted to recognize that this is a population that needed the attention, that needed the resources, and needed the program services in their communities and work sites, so that therefore they can pass through this pandemic alive and well into 2022. So that was a quick presentation. If you guys have any questions, feel free to let me know. I'll be more than happy to go into detail or expand on some of the projects that we have going on in Central Valley.
Thank you so much, Hernan. That was such an informative overview of your organization and sort of its structure and the way that you work, as well as the response you've had to COVID. I know that we're going to start getting some questions. So while those are coming in, I'm going to pose a few. One is actually going back to one of your earlier slides where you had the bar chart of the different concerns that farm workers have raised through the survey. I might have missed it, but I didn't see that workplace concerns, whether they be, hazards in the workplace or labor concerns on that list. And I'm curious if that's because it's not a primary issue for them, or if it wasn't a question asked, or if you have any thoughts on it.
Yes, that's a good question, Heather. We notice we do a lot of work on the ground. We thrive on not only working in the fields with our staff, but we did include labor rights. We brought it back again because we were noticing that whenever we would collect data, labor rights was something that was very minimal in the responses by farm workers. So there is the intention this year to actually look at labor rights and look at the different entities that make up labor rights, and actually providing farm workers with some options so that therefore they can tell us exactly what they would like to learn when it comes to labor rights. Because when you see the survey, right, you have professional development, immigration and citizenship services, you're gonna look at that survey, and some of the farm workers, they'll look for the most pressing needs. And sometimes they'll look for immigration, they'll look for professional development, or whatever personal development they wanna work on. But we are working on developing a survey that would just encompass labor rights, so that therefore we can better serve farm workers. One thing I can tell you though, when it comes to like labor rights and when we have dealt with some of the situations with farm workers on the ground, is that it's very personal. We notice it more when we're out on the ground. We'll have a farm worker that would pull us to the side, or they'll call our hotline and they'll say like, hey, like I need help, I'm going through this. And then that's how we try to best serve their needs. But I still do think that we have a lot of work to do in that sector. And we are looking forward to creating a new survey that's just going to encompass labor rights in general.
Thank you. So it's almost like there's a need for more knowledge about what things they should be perhaps asking for information about, because the information is not very accessible currently.
Yes, no, exactly. I would agree.
Okay, great. So let's see. So a question about your work in the Central Valley, in particular Merced and Stanislaus counties. Do federally qualified health centers provide telemental health services to farm workers?
The telehealth service with all these FQHCs, I think, has been a big failure for our population. And I told a lot of them when they were showing me their data and their numbers, they literally went when the pandemic was occurring, they went from telehealth to actually just taking a lot of the calls with farm workers via phone, because they knew that telehealth just wasn't working. They weren't able to go through. But when it comes to mental health, I would say that mental health is one of the sectors that this pandemic has really, I guess, hasn't spent too much time on when it comes to the organizations on the ground. I know for us as an organization, we haven't spent too much time promoting mental health, but I do think it's one of those sectors that we need to spend more time in, because we did see it through our focus groups and through the data gathering that there was a need for mental health services for farm workers there. But I do think as of now, we operate from Madera all the way to Kern County. there hasn't been a big push for anything that has to do with telehealth, whether it's health driven or mental health driven.
And actually, in your response, you answered another question that we received, which was about mental health services. And so from what you're saying, it sounds like I'm hearing that you haven't seen a lot of mental health services, but are you seeing the need for them? And what are some of the examples of mental health issues that you're witnessing among farm workers?
You know, we have seen the need when we did 2 focus groups. We look at the Latino population, the Filipino population. We knew that every group was getting hit hard, whether it was with anxiety, with depression, the lack of being able to operate as a collective, visiting their family members, going to their faith-based organizations. But we have seen the need of mental health literally on a day-to-day basis. We see it, farm workers struggling. And one of the major things that we have been noticing too is just the financial stressors when it comes to like rent relief and farm workers being concerned over whether they're going to have a roof over their head during this pandemic, and then translating that into anxiety, depression. So there's definitely a lot of structural needs that farm workers are getting affected by. But I do think there's has to be more time spent on the mental health of farm workers. And we've seen this once, Heather. One time, I remember when we first got into mental health, we hosted a workshop in a small little community in Tulare County. And the interesting part, we had a full house. And one thing we got out of that workshop was that every single individual there wanted some type of service. And when we look at the demographics, 90% of it was farm working women. And when one thing we noticed too, that it wasn't really the young people asking for the mental health services, but rather it was the parents that were going through a lot and were coping with life, and the need for mental health services was just there. They just wanted somebody to talk to, somebody to guide them. And the other thing that we also noticed in Tulare County was that when I talked to the FQHC at the time, I said, hey, so you have 30 farm workers here that are ready to go. How do we create the follow-up? How can they get an appointment? One thing they told us was that literally the capacity that they have wasn't there. They wouldn't be able to provide the follow-up. And especially given that they were in a rural community, then they would have to go, if they were the ones that they could go in, they would have to go to an urban community. And we know that transportation continues to play a big barrier in areas like the Central Valley. So I do think that there has to be more of an emphasis in mental health, and not only in the urban areas, but in the rural communities where we see that the needs are high.
Wait, everything you're saying, I think, reminds me of conversations that we've had with other CBO partners, that this pandemic is exacerbating all the many vulnerabilities and inequities that exist in this population pre-pandemic, and it's being exacerbated during the pandemic.
Yes, definitely. No, I agree. And in regards to promotoras, Heather, so when I was at the public health department in Tulare, our job was to create the Promotora Model with Visión y Compromiso. Great organization, great CBO. One thing we realized though, when we were capturing data with our farm workers and the Promotora Model that we created, and we invested a lot of time in developing promotoras, but promotoras that actually worked in the fields, that actually wake up every morning, cook for the family, come back and do the chores. Because one thing we were noticing with the Promotora Model was that a lot of the farm workers, when you would go out and you'll talk to them, right? And if they weren't working in the field, if they were like stay-at-home moms or maybe working part-time jobs, then a lot of the farm workers would tell us that they just couldn't relate to the individual telling them to change their behavior because they didn't go through what they went through. So they would tell them, you have to do A, B, and C. And the farm worker would tell us like, I can do A, B, and C if I stayed at home and not work. So anybody can do a behavior change. So one thing we really developed was how do we look at the Promotora Model and look at incorporating farm workers so that therefore they can become champions and they can go out and advocate within their peers on how to create some of the behavior changes that the model is interlinking, right? When it comes to health or when it comes to accessing services. So this is something that we took to heart. I kind of, given that I got the opportunity to create the model, I just thought we have to make some changes, and we got to be able to accommodate farm workers so that therefore they could carry on the message, because we know it'll translate into more effective behavior change as opposed to somebody telling them that can't relate to their day-to-day living.
That's great. Thank you. I want to ask a question that goes back to your ambassador program, because I think one thing that we see is that oftentimes groups that serve organizations that serve farm workers are often different than organizations that are serving employers. And it's not very often that there's groups that are trying to bridge that. And that's something that you seem to be doing with the ambassador program. And I'm curious if you could describe a little bit of that and a little bit more about how you can make it work where you have farm workers and employers working towards the same goal, and maybe you can identify any of the challenges that you faced in that process.
Yes, no, definitely, Heather. First and foremost, the thing I want to say too, when it comes to our programming, when it comes to our relationship, the way we look at our work is how do we work together for the benefit of farm workers, because we know that working together can go a long way. We know that without agriculture, there's no farm workers. Without farm workers, there's no agriculture. So it's an interrelated relationship. The way we navigate this system is that first and foremost, we're always going to do what's best for the farm workers at the end of the day. And that's something that we hold to heart and that we're not going to change by any other organization or whatever agriculture association tells us. But we work closely. I think at the end of the day, you have an industry that cares about their employees, that wants to work with their employees, that wants to better their life. And we're also very selective of who we partner and who we work with. One thing I tell the agriculture committee is don't come out to me when you need help. You know, when a fire is being done, at that point is no, we work with companies that we feel carry our mission to heart and that are going to put in the time and effort and that are not just going to say, hey, here's a check or come back during this time for help. It's we are interested in relationships and in relationships that are real and that we know are going to be for the betterment of farm workers. So we carry this to heart. We work very closely with the industry. And the thing that I like about our organization is that we still retain an autonomy over anyone. So we work closely for the betterment of farm workers, and we have been able to do great things with the agriculture industry. But it all comes back to making sure that that partner that you're working with has the same mission and has the same values that the organization has for farm workers.
Great, thank you. We received a question about the vaccine rollout and the outreach that you're doing. Sort of what are you doing to communicate to workers about the vaccine so that they feel safe and comfortable getting it when they are offered the opportunity?
So we have the hotline in which they could call and we could answer any I guess, question that they have in regards to the vaccine. But we spend a lot of time, a lot of our staff, literally 70% of the time they're out in the field, they're in the work sites, they're in the communities. So we spend a lot of time educating them, not only developing our own infographics, talking to farm workers, and making sure that they have access to all the information that's factual for the vaccine. We also do some advertisement on social media platforms like Facebook. So we want to try to make sure that farm workers could hear us not only on social media, in the radio waves, in TV, but also face-to-face in person when we go out and do our outreach events.
Thank you. Okay, so this is the nice thing about having a short presentation on a really great topic is that there's so much time for questions. So everybody continue to add them as you have them. But another question about community-based resources and asking for some examples that you use to supplement your work and that you find to be effective. I think that we see a lot of examples of resources developed, but it's great to know on the ground what works.
Yeah, so I think when it comes to community-based resources, we always tend to look for partners that are, if we can't fill in that void, if we can't provide that resource, then how do we partner with local organizations that have that? So we're big on partnerships, on making sure that CBOs that are working in similar sectors for farm workers also support us. So whether it's distribution of PPE or even partnering with medical providers to provide all the health services that we offer, then it's just a partnership, and we look at different resources that are available to farm workers. But more than anything, we look at data, what their interests are, and from that data, we're able to capitalize on partnerships to create those to fill in those voids that they have.
So you mentioned social media a few minutes ago, and it seems like you use it as a way of complementing the on-the-ground direct outreach that you're doing, sort of person to person. When you're using social media to communicate, is it just sort of a broad blast out to anyone who might follow your organization? Do you like sort of how do you operationalize that? Because I think social media is commonly just thrown out as an idea, but how it actually works at a local level is always good to hear.
Yeah, so we're very proud to say most of our likes, followers on social media, we noticed that Facebook is a platform to talk to farm workers, and most of our followers are farm workers, so that's a good way for us to connect with them. But we also do some like micro targeting. We start looking at different communities in which we're going to host events, and we start advertising there. So we do a lot of work on social media, ad buying, and just during the pandemic, we spent like around, I think in coordination with the Table Grape Commission, around $30,000 just on advertising. So we looked at different communities in which we wanted to make sure that farm workers were getting the message in regards to COVID-19. And we just decipher all of our infographics into these communities. And another thing too, if you really want to get bang for your money and not pay for advertising, then we would look at sites on where we know farm workers would look at. So whether it's all those for sale signs, sites, so we'll have like Delano Ventas or like Readly Ventas or anything that we knew farm workers might be attracted to, then we would just log into those accounts and then we would just post all of our flyers there.
That's creative. Yeah. Yeah. Social media, you can definitely, if you know the target, you can reach a lot of people through it. And I think that something that we've generally learned is that having materials and resources tailored for an audience is going to have a much greater impact than, just a generic COVID informational sheet. So the ones that because the ones you're creating are specifically for farm workers, correct?
Yes, it's specifically for farm workers, and I think it's important to be on the ground. So I remember we were in 2 weeks ago in Fresno, and we had two groups, and we were kind of learning about farm workers and seeing how they were going to take the vaccine. Were they interested? So we had two sample sizes. One sample got education, most of them got vaccinated. The other sample, we just said, hey, come on over if you're interested in getting the vaccine. We're here. We noticed that there was a lot of hesitancy, and we were working with Dr. Solis from Fresno County Public Health. So we had about 10 farm workers that were just like, no, like I'm not interested. And we had Dr. Solis and our staff talk to them and just literally get rid of all the myths, give them the direct education. All those 10 farm workers ended up getting the vaccine right then and there. And that was just from a brief 10, 15-minute conversation. But the important thing too, Heather, that I guess I would want to emphasize is anything that we do in the field, farm workers are getting compensated for.
Mm-hmm.
So we want to make sure that companies are invested. And we think it goes a long way because a lot of times programming when it comes to farm working crews happens during their break, during their lunches. You'll have like these radio stations go there or transmit. And I think the way we see it is everybody enjoys their breaks or lunches, right? Nobody wants to be bothered during that time. That's the time when they're resting, they're working hard. So the way we see it is we're able to captivate their attention more when we know that it's on an employer time. So whether it's bringing healthcare services, COVID-19 vaccines, or COVID-19 testing, we are big in making sure that every employee gets compensated for the time so they don't have to worry about getting compensated, but we also know that it's more effective when it comes to them actually listening to the education that we're giving them.
So is that something that you work out with employers at the start when you start partnering with them, that this is, because I think that is maybe a fairly unique attribute, because you're right that a lot of these services, if they are offered at the job site, they tend to be on the worker's time, not on paid time. So how do you work that out with the employer?
We work with employers from the get-go. We tell them what the expectations are. And if they don't want to fulfill the expectations, then we move on and go to someone else. We have a mission statement. We have our parameters in place, and we won't sacrifice those parameters for anyone. So either you get on the boat or you don't get on the boat. That's the way we look at it.
That's great. Okay, so another question related to similarly about reaching farm workers, sort of what you see as the benefit and whether or not the job site is the most effective way to reach farm workers versus, say, a community setting or maybe a clinic setting.
I think the work site provides a lot of opportunity, especially when farm workers are being compensated. And a lot of times you got to recognize that farm workers really work long hours. They work during times in which a lot of times I always talk to the county about this because they never want to work weekends or they never want to work after evening hours. And sometimes farm workers, they don't have access to these types of programs and services. And when they do have access, they're tired, they get home, they just want to rest, they want to eat, they got to have dinner. So when you're inviting them to some workshops occurring in the evening, it's always a tougher time to not only get their attention, but for them to attend. So the way we see it is if we could captivate their attention right then and there at the work site, then we know it's going to go a long way, as opposed to in the evening or whenever they just don't have access to the time.
Absolutely. I think that makes a lot of sense. All right, folks, you still have a few more minutes if you have other questions. Let me take a look here. I guess one thing that I'm curious about is just what have the greatest challenges been? I think you've been at this for almost a year related to COVID outreach and education. And if you were to look back across the year, what have been the greatest challenges you faced overall?
The greatest challenge, I think, for us is not being able to meet the demand. As we're growing infrastructure wise, as we're bringing in new companies on board, it's always difficult, right? Because you're bringing in, depending on the company size, you're bringing in around 2 to 3,000 employees. So how do you meet the demand? So it's always been tough. So we look out to a lot of our community partners, making sure that they're able to help us fill in some of the voids that we can't fill in. But I think the biggest challenge has just been getting the resources in order to continue carrying on with this work. So whether it's like PPE, when PPE was occurring, when there was a shortage in just N95s, just the struggle for us to get these N95s was just overwhelming. And we had to look out the private sector, the public sector. We're trying to get anywhere we can. But I still, till this day, I would say the challenges of being able to meet the demand are still going to be some of our biggest challenges as an organization, just because we've been growing. We went from a staff of 5 to now over 20. Operations continue to grow. And now that we're looking into potentially expanding into other areas of California, I think it's just having those growing pains and just trying to make sure that we're able to reach every farm worker that we can.
So the challenge is, so that's interesting because it doesn't sound like the challenge has necessarily been the myths or misunderstandings that people might have. It sounds like it's been the demand has been there related to COVID. It's about your ability to provide the resources and the information.
Yeah, the demand has been there. When you're looking also at the healthcare sector, because we do a lot of public health work, when the public health sector got hit hard and when all hands were on deck, then it was very difficult for us to even partake in some of the health services that we wanted to provide to farm workers, just because we couldn't find the providers that would be able to help us.
Yeah, actually, and so building on that, what would you say is the biggest challenge working with federally qualified health centers?
Federally qualified health clinics, Central Valley, it's kind of interesting over here. It's kind of, they all, before there was like a pack, right? And all these clinics would stay on, you're on the east side, you're on the west side. Now it's like a free for all. Everybody's trying to get into everybody's territory. So one of the biggest challenges for us is making sure that we stay autonomous, that we don't go out and choose providers or take sides. But that's one of the big challenges, sometimes the politics that some of these FQHCs have. So we got to make sure that whenever we're working in a specific area, that we work with that specific FQHC. And if they don't have capacity, then we invite a third party. But some of the politics can be a bit interesting with some of the FQHCs. Right now, if you were to ask me what's one of the major challenges when it comes to COVID-19 vaccines with FQHCs, the information that they're asking. Mm-hmm. So we've been working with different counties. We know that they have to get paid, they have to get compensated. But one thing I'm telling them is you don't have to ask for social security numbers. You don't have to ask for if you're on government assistance, because we know that questions like these affect farm workers in getting the COVID-19 vaccines. And we have noticed this, in which we had 100% commitment rate from farm workers. And the second we rolled out the FQHC application, which encompasses social security numbers and all this information that they need for their billing purposes, it went down to 60% of farm workers that were now interested in the vaccine. So it's just working with some of these FQHCs and working with the counties to get them to only get the information that they need, so that therefore farm workers have complete access to the vaccine.
Yeah, I think that what you're raising speaks to the deep fear that many farm workers experience interacting with different state and federal institutions, right?
Yes, and we know that they have to get compensated, right? Every single FQHE has told me that. They told me, Hernan, I have to find a way to bill it.
Yeah.
Well, I think the counties, we can work a different system in which it doesn't encompass too much information. Kind of similar when testing was happening. A lot of these FQHCs, one of the biggest things that I was telling them is they wanted to do a health visit to every single individual that was getting a testing.
Mm.
And that was because they wanted a bill that they seen a farm worker. And so we weren't too happy with this. We were always pressuring the state and the FQHCs to just give it, you're going to get minimal information, make it as comfortable to the farm workers so that they can partake in the services. Because if you start asking too much questions, then they're more than likely not going to participate.
Interesting. A different track question, one back sort of to the ambassador program and the way that you're working with employers. A question about what that structure looks like, and is there is it is there a fee structure? How do you build that into your capacity?
No, there's no fee structure for our ambassador program for the companies to join us. Right now, we're mission driven. So if a company's interested, they just gotta be able to accept the preconditions that we have, the parameters that we set as an organization. And it all comes down to they really have to believe in us. They have to champion our work. They have to put in the time in choosing an individual that's a decision maker, so that therefore we can have access and we can have the programming that we would be set to do on a day-to-day basis. But if you look even at our funding model, Heather, our funding model, literally agriculture companies make up around 16% of our funding streams. Most of it now we diversified. So they are still a portion of our funding streams. But right now we're still not there where we're actually asking them that they have to pay a certain fee.
That's great. Well, I think that we have covered many topics and questions, and I know that all of us here at the Western Center for Ag Health and Safety are appreciative of the work you're doing and the fact that we get to work together in partnership on some of the COVID-19 outreach. And so I want to thank everyone for joining the seminar today. It was really informative and relevant to on the ground activities that are happening right now across the state. For those of you who might be new, please do join us next month for our seminar and sign up for our newsletter and other things. Yahaida is putting information in our chat. We are thankful to have everybody here, and very big thanks to Hernan and then to Reina for interpretation. And we will see you all again next month. Have a great afternoon.
Thank you, Heather.
Thank you. Bye.
Bye.